I found out that I had breast cancer on the 24th of June 2022. That was 4 or 5 days after having the biopsy. So I had the weekend, that was a Friday, I had the weekend to think about that and what that meant. I believed at the time that it was probably a very localized cancer, that maybe there was no invasive cancer at all, in fact, that maybe it was just a tiny spot of what they call lobular carcinoma, lobular cancer, that was just what they call microinvasive, just starting to break out. This was all detected by little calcifications. These are little spots of calcium that pop up in the ducts of the breast gland, and they can be seen on X-ray or mammogram. And so that's how they detected this abnormality to begin with. The area was biopsied. It detected what they call ductal carcinoma in situ, or DCIS. That's pretty low-grade cancer. And in fact, there is a lot of discussion amongst experts as to whether that actually represents a cancer at all in some circles. But I had a bit of DCIS, also LCIS, lobular cancer in situ, and a tiny spot of microinvasion of lobular cancer. The doctor who I spoke to thought that even potentially that they may have gotten all of that out just from the biopsy. So she felt very comfortable that it was a very early stage cancer and that I would hopefully get away with a localized excision, which would have been wonderful. The following Monday, I got on the phone to the offices of some local breast surgeons and managed to get in to see one of them a couple of days' time, which was very lucky. She's someone who's known to me, who's an excellent surgeon, and she's about to go on leave. So I was very lucky to be able to pop in and see her before she went on leave. But she did ask for me to go and get an MRI scan done first. Her concern when she spoke to me on the phone was that although the cancer diagnosis had been made from the spots of calcification on the mammogram, and that DCIS and LCIS and the microinvasive area had been found in the biopsy, she was concerned because she felt that the lobular cancer may have other areas within the breast that weren't seen on the mammogram because there weren't any calcifications there. So just to be sure that that was the whole extent of the cancer, she sent me off for an MRI. So I did that on the Wednesday, went and saw the doctor on Thursday, the cancer surgeon. So that was about 4 days ago. Unfortunately, the MRI did show that there is another area highly suspicious of lobular carcinoma, which would be an invasive cancer in the breast tissue near the original area of the calcifications. I will try and get hold of some of the images actually and put them up to show you in some of my future posts. But for now, anyway, there's looks a bit on the breast tissue that looked like buckshot on the mammogram, which was where all the little spots of calcifications were, and then off to one side of that was where this other area was that couldn't actually be seen on mammogram, and they detected it on the MRI. So I had to have another biopsy. I went in on Friday, that was 2 days ago, to get an ultrasound guided biopsy on the new area just to confirm that it is what we think it is. But based on the appearance and the experience of the doctors who've been examining me, they're all pretty sure it's going to come back showing an invasive cancer. So not so simple as I thought. Originally, the thought was that maybe I could get away with a local excision, but after my discussions with the surgeon on Thursday, after the MRI, she's pretty sure that that's going to come back showing cancer, and she'll be recommending a mastectomy on that basis.